Hey there, this video is for you, Dr. Thistle. I hope I'm pronouncing your name right. And this is coming at you with nothing but the utmost respect. I did reach out to you trying to set up an interview for a webinar to discuss the video that you put out about some myths about chiropractic. Now, I do agree with a lot of what you say. I think you, from the little bit I know about you, and watching your video, I think you're probably a tremendous asset to our profession. And what I'm gonna try to do in this video is to try to give you a little more information to follow up on some of the things that you said. And I hope that you take this with my sincerity, and we actually come to agreement, or at least we can discuss, because I think you and I are a lot on the same page more than we're off of it. And I know it sounds like you weren't happy with how I was trying to contact you through social media in private messages. And it was done, as I mentioned many times, I was trying not to have any arguments. However, I want to give a little more information. And when it comes to some of the things that you say you do some med legal work. I do med legal work too, and I'm really not even sure what that means. Like, I've testified as an expert. I know some people get hired to do IMEs, and that's all considered med legal work, but two totally different things. So let me just go on a little bit to follow up with some things that I agree with and things that I don't agree with. And I hope you watch this video, and I hope after the video you can call me. Maybe we could do an interview, because I think after this video you're gonna see that I'm coming at you with nothing but respect and just trying to up and raise the bar of our profession based on knowledge and education and professional communication. So in your video, you mentioned, you talk about misalignments. And one thing I found interesting is the misalignment that you show in your video. There's an anterolisthesis. Now, what I would like to do with that is, you say there really isn't any bones that get misaligned. But if a patient has an anterolisthesis like that, that is a sign of instability. Many studies show that from Yale and everywhere else. And what should follow up, and what we should tell patients or docs when they see that, is we should at least do a flexion extension, measure it according to the AMA guidelines and other guidelines for radiographic mensuration to see if in fact that is a pathological state that may need further treatment or may need us to do different forms of treatment. Now, you also mentioned that there's no evidence that bones move back into place. Now, here I agree with you on one hand. I think if you're just doing chiropractic and you're adjusting, whether non-force or high velocity, there really isn't any evidence to suggest that the bones go in place. But what I would like for you to take a look at is some research and some papers that have been published by Chiropractic Biophysics nonprofit, which I don't know if you are aware, but they do have more studies published than any other chiropractic technique. And what their studies do show is that the bones, in fact, do go back into place. And there are some case studies also showing how spondies, with appropriate chiropractic care, chiropractic biophysics care, that bone does go back into place. I will put a picture up here in this video also showing you the work that I've done in my office. We also show that the bones do move back into place. Now again, I did chiropractic biophysics, a corrective treatment, not just a chiropractic adjustment and let the patient leave. And I can show, and these studies do show, the bones do move back into place. So if we're gonna say that it doesn't, that's making a giant umbrella, which I think you did, but it's also leaving out some techniques in our profession that have been shown and can prove that the bones do move back into place with appropriate care. Now, you also say that the bone out of place is not supported by science. Now, you use a paper from 2009, which, okay, it's a paper. But let's take a look at a lot of these other studies. Let's take a look at the ICD-10 codes, right? Those are federal diagnosis codes of anterolisthesis, retrolisthesis, kyphotic alignments, loss of the cervical curve. Those are all bones being out of place. Now let's take a look at what some of those studies show. Those studies show that Instability leads to chronic pain. Instability can be permanent injuries. Instability can be found on x-ray, both in the neutral and lateral and flexion extension views. In fact, White and Punjabi's book shows that a sign of occult instability, one of the signs is a reversal of cervical curve. Now, reversal of cervical curve is a bone and a place, just like an antero or a retrolesthesis, and to some degrees, even like a spondylolysis listhesis. That is a break in the pars and the bone slips forward. That is a bone and a place. So I don't necessarily agree that the science doesn't support that. The paper used is 2009. I'm going to put some references in here for you that are much newer. In fact, most of them are this year, 2016 to 2017. You say regular back or neck pain should heal. However, I'm not really sure what regular neck or back pain is. If I take a person and I slap them on the back of the neck, is that regular neck or back pain? What about a patient that wakes up and their neck is stiff and painful? Is that regular neck or back pain? What if that patient's neck pain was from a torn facet capsule? What if that patient's neck pain was from bleeding in the facet joint? What if that person's neck pain was due to a kyphotic alignment? What if that person's neck pain was due to a kyphotic alignment causing increased tensile stress on the central nervous system? What if that person's neck pain was due to a Chiari malformation made worse by abnormal sagittal alignment? That is not normal neck pain. So if, and it drives me crazy too, if doctors are saying, oh, you have back pain and let me just adjust you, we don't know if that back pain is discogenic, facetogenic, ligamentous, abnormal sagittal alignment, or instability. And all of those things are going to respond differently. And the quicker we diagnose it appropriately and apply the appropriate care, the better outcomes and the less expensive it's going to be for that patient so they can become a higher functioning person in our society. You also mentioned, do not repeat x-ray. Well, I agree with you. If you're not doing CBP or corrective care and you x-ray the patient, I wouldn't x-ray him again either because it's not going to show that there's a change. But if you use and you x-ray the patient and you tell them and you educate them that they have a loss of curve and your goal of care is to restore that curve, not just from a marketing perspective, then you should re-x-ray that patient to see if what your goal of care is actually improving with your treatment plan to make sure that they're not getting worse. You do mention that regular adjustments don't fix the curve. And again, I completely agree with you. Regular adjustments don't. But this again is a gigantic umbrella that you're telling whoever your audience is watching this that, hey, chiropractic's not going to fix the curve. Well, I'm a chiropractor. And the chiropractic that I am going to do and what I perform has been shown consistently to fix the curve. So maybe what you could say is, hey, if the doc that you're seeing, the chiropractor you're seeing is not doing corrective care like CBP, do not expect the curve to change. Now, I'm not here to throw the other techniques under the bus, but right now there hasn't been anything published other than CBP and some corrective care techniques that the curve will improve with that treatment. So I do agree with you on that. As we mentioned, I think we're on a lot of the same pages here. You do say that lots of docs use this to get patients. I think your mention about the loss of curve. Again, man, I completely agree with you. And I blame the marketing groups that are out there, the so-called marketing gurus that are out there. I blame even some of our schools that are allowing these marketing gurus to teach our young docs how to use x-rays to scare patients into care, but then teach them nothing about the science on what that loss of curve is and the treatment like CBP to help fix it. I don't have a dog in the fight when it comes to CBP. I don't get paid by them. I present for them and I've done some work with them because I think their research is fantastic. So I'm not here to say you should join CBP because I'm going to get anything financial out of it. I'm just here to say that if they are using this scare technique or tactic as a technique to get more patients in the door, but then they don't do anything to fix it that has been proven to fix the curve, then yes, I have a huge problem with that just like you. But what we should do is opposed to say, hey, chiropractic doesn't fix the curve, and it's used as a marketing technique, is say, hey, wait a second, outside these corrective care techniques is. So hopefully we can change that. Hopefully we can educate more docs about how we can fix it from a chiropractic perspective. So you do mention that fixing the lordosis is not taught and not the standard of care. Well, one, it is taught. It's taught at many schools by CBP, and it is a taught method and a proven method. The other thing where it is a standard of care, it's also a standard of care in the other healthcare communities, such as surgeons. A number of studies, in fact, one just came out this week in 2017 about how sagittal alignment, when it comes to fusion, gives better long-term outcomes. So even surgeons are understanding and know that a abnormal sagittal alignment decreases outcomes. And now the standard of care is starting to be, when they have to do a fusion, to try to fuse it in a more lordotic position. So if the surgeons have a standard of care to fix the curve with hardware and fusion, so should chiropractic, because it is a standard of care. It's looking at an abnormal sagittal alignment that has been proven in the literature to, if it's bad, to decrease someone's health-related quality of life and bring on other pathologies. And if it's good, it is proven to actually give better long-term outcomes and better long-term health care or long-term health. You do mention that one of your peeves is body shaming of bad posture and like a leg length discrepancy. Well, one, sure, I agree with you again. If docs are using this as a way to get patients to sign up, like, oh, look, your head is forward, your shoulders are sideways, you have a leg length discrepancy, that's bad for you, let me treat you. But they're not implementing in any forms of care to actually follow through with these abnormal postural distortions. Yes, that is wrong. But what it sounds like on this video is you show a picture of someone's shoulders. Well, should we not look at that? Abnormal shoulder alignment like that can be correlated with scoliosis. Why should we not look at that and understand what it is and maybe help us get further tests to see if they do have a potential scoliosis with unlevel shouldering? Because that will need to be addressed. That will need to be helped. What about if they're hunched forward and they're constantly on their computer? Should we not look at their posture to educate them on better ergonomics? Ergonomics, as you know, I think, is a huge part of health and a huge part of healthcare. And ignoring proper ergonomics, I think, is below the standard of care. What about a leg length discrepancy? If a person has a true short leg that's causing spinopelvic asymmetry, which is going to cause a scoliotic deformation, should we not be aware of that leg length discrepancy to potentially put in a heel lift? I don't think that's body shaming. Now, yes, there are some docs that are using it in unethical ways to get patients to sign up, but doing nothing about it. That, in my opinion, is wrong. But if you're using it to give them exercises, to give them appropriate techniques and treatments or heel lifts, or maybe having to refer them out because you saw the person's shoulders were like this, like you mentioned, and they had a very significant scoliosis, it is our job and duty to then refer them into an orthopedist for surgery, for scoliosis surgery, or for a brace. But if we ignore those signs, then we could be ignoring what our job is, which should be to look for things to improve patients' health. You also mentioned that you cannot modify it with treatment. But what if there is a treatment that has been published showing that it does improve those things, like chiropractic biophysics has? Now, again, if you're talking about every other technique other than corrective care, then yes, you do have a very valid point, and I agree with you again on that. But we have to look at what chiropractic has to offer. And if you're applying corrective care and you're applying chiropractic biophysics that has numerous papers and case studies to show how this can improve the patient's sagittal alignment, coronal alignment, and posture, which is going to improve their long-term health, it should be done, and it should be recognized and discussed, as opposed to putting this giant umbrella again over chiropractic, saying chiropractic doesn't do that. Because chiropractic biophysics and other corrective treatment has been shown to actually do that. You do say that the evidence does not support long-term care. Well, what evidence and what is long-term care? What if a patient had a kyphotic alignment and the research shows that if left untreated, it will get worse? What if the research shows that it will decrease vascular supply to the end plates, causing the disc to degenerate at a faster time within, let's say, 28 days? What if there's treatment to show that as you improve, as you have an abnormal alignment, it constantly changes the vascularity to the spinal cord and pulls the spinal cord, potentially irritating your central nervous system? And what if there is a treatment that can minimize and either reverse that kyphotic alignment or slow down or stop the progression of it getting worse if left untreated? Is that considered unnecessary treatment? Because chiropractic biophysics and a treatment to improve the sagittal alignment can take a period of time over than just getting out of pain. But that is necessary. In some ways, if you had almost a heart attack, and you went in and they're like, look, you're 80% occluded, but you're no longer having the symptoms, does that mean you shouldn't apply long-term care, such as changing your lifestyle, diet, and exercise? No, but that's long-term care. And when you start to look at the science about sagittal and abnormal coronal alignment and what chiropractic biophysics or other corrective care can do, it strongly suggests the need of long-term care. Now, it may not need to be in our office 3 to 4 times a week, but patients sitting up straight, maybe doing some form of traction at home, maybe understanding what's happening and coming in for a treatment so that we can improve that sagittal alignment for better long-term outcomes. You then also mentioned that neck or back pain evidence suggests you will recover. Now, again, you're using neck or back pain. That's like a diagnosis from the 70s or 80s. As I mentioned earlier, what if it's a facet? What if it's a disc? What if it's an abnormal curve? All of those have been published in the literature to cause pain and to get worse if left untreated and lead to more chronicity. You can't lump these patients in with back pain. Like, oh, I worked out too heavy, I have a little bit of sprain strain. Yes, they're going to get better on their own, but not with a facet damage, not with an abnormal sagittal alignment. Physiological changes are more likely to happen than not if left untreated. So I hope that you find this video to be informative to you. If you truly are into your video and my response to your video, let me invite you to the next Chiropractic Biophysics Conference, where we talk about spinal mechanics. We look at the clinical case studies. We look at how we can improve these things. Because I agree with you, Doc, not all chiropractic can do this. But to say chiropractic can't, when there is proven, regulated, taught techniques such as chiropractic biophysics, when it's shown that it can, now we're talking about two different things. So please, man, reach out to me. Let's talk and discuss. I think you and me together, getting on the same page and discussing this is only going to help the public and help our profession. So I look forward to hearing from you, and I really look forward to meeting you. Have a great day.